shared commitment to addressing cancer.
It's about a powerful role we all.
Cancer remains one of the leading causes of death worldwide. But through awareness, prevention, early detection, and equitable access to treatment, millions of lives can be saved. World Cancer Day reminds us that every voice matters, every action counts, and together we can reduce the global, national, and the state burden of cancer. The global cancer burden is estimated worldwide since from 2022 to 2025 stands at 20 million annually. Death worldwide due to cancer stands at 9.7 million every year. Most common cancer globally are the breast, lung, colorectal, prostate, and stomach. Key drivers are tobacco use, unhealthy diets, physical inactivity, infections like HPV and hepatitis, and environmental exposures. The burden of cancer in India, there are new cases. The statistics from 2022 stands at 1.41 million, and death stands at 9,16,827. Projected new case by 2035 stands at 1.57 million. Most common cancer in India for men is oral cavity, lungs, and esophagus, and for women it's breast, cervix, uterus, and ovary. Risk factors are tobacco use, infections, late diagnosis, and limited access to advanced treatment in rural areas. Nagaland is among the northeastern states with a high cancer incidence, particularly linked to tobacco use and dietary habits. Common cancers like esophagus, stomach, and nasopharyngeal, which is linked to tobacco, smoked meat, fermented foods, and betel nut chewing. Nasopharyngeal carcinoma, Nagaland has the highest incidence in India, both men and women. And mortality, according to the latest National Cancer Registry fact sheet, cancer is the fifth leading cause of death in the state, which is around 28 cancer deaths per 1 lakh population. The number of cancer cases and age-adjusted incidence rate per 1 lakh population in Nagaland is as under. For male, it is 1 to 4.5 per lakh population, and for female, it is 88.2 per lakh population. And this source is from ICMR Cancer Registry.
When I was diagnosed with breast cancer, the initial thought that came to my mind is, I will never go for treatment. Like me, there may be so many people who have thought that. Because of stigma, people start to think, oh, he is or she is a cancer patient. They start the lineage, what happened to their forefathers, what happened to the parents, and what happened to them, things like that. Our Naga mentality is such that now at least, people are opening up. Because, cancer cases are like mushrooming. And that time it was right? But still then people have that kind of thought. And the psychosocial was that led me and many cancer patients to disclose. I didn't want to go for treatment. Just imagine. And I thought I'll just die like that without undergoing treatment. But then one evening, I didn't share anything. I was just my normal self. I was acting very lively. But then one evening, my youngest son told me, these few days I'm observing that you are very quiet when you are alone. So then I thought I will have to share the cancer diagnosis. And I called all my family members, like my husband and my children, and we sat for a prayer fellowship. And there I told them that I've been diagnosed with breast cancer. All my children started crying. And he told me, when did you learn that you have breast cancer? When did you learn that you have cancer? Right? Some weeks back. But I thought I would not share. Because if I undergo treatment, it will be a burden to the family. This is my story. Because every cancer patient has their own stories. And it's very unique as the theme shows. So I thought I will not go for treatment because I do not want to burden my family. And then I really did not want people, judging me. Maybe you might have done something wrong. What mistake did you make? So those things came into my mind. And then, when my children started crying, my son asked me, what cancer is it? I said, breast cancer. That can be easily treated. Why are you hiding? And then that night itself, we discussed that we should go for treatment. And that's how we started the treatment journey. I said, if I go for treatment, I will go to Kolkata, Tata Medical. Because if I stay in Nagaland, there will be so many visitors who will come to observe, who will come with pity and with so many negative thoughts. I say, if the family can afford, I would like to go to Kolkata, because once we start the treatment, we'll have to go for follow-ups and we'll have to go for reviews. So I think that is the closest. So that's how I went to Calcutta. I stayed there for about a year, and then I underwent the whole treatment in Calcutta. During my treatment there, I knew that when we take chemotherapy, my hair is going to fall. I will have all those nauseous things, the ugly things that people don't want to go through. And so I bought a wig. And after my first chemotherapy, the nauseous feeling was, my taste was like ashes. It didn't taste good at all. On top of that nauseous feeling. And as I was battling with that, another ugly thing started falling off. I had a very beautiful strands, very silky hair. And to see my hair falling was, it was unbearable. I knew it. I have bought a wig. But still then, the emotional journey that I went through during that time. And then that's why I told my son, just go bring a razor. And I told him to shave my head. I was sitting in front of the mirror. My son, just shaving my hair. I was trying to joke. I was trying to tell him that this is going to be a new look. I was wearing a very big red lipstick and, very high, heavy eye makeup. And I was just trying to normalize, it was not a normal thing. Not any sensible son, a loving son who loves his mother will have the courage to shave the mother's hair. And that's when, my son was all tears. It was not shedding, but it was blurry. And then my daughter could not see my hair being shaved off. So my daughter was in the other room, trying to stay away from me. And after that, my daughter really adjusted my new looks. And I was very positive. I was trying to be positive. I didn't want to show them that I'm going through that pain. But still then, to see my children looking at me, trying to, compare the previous look, the old look and the new look that is so bald. Eventually, I'm going to be bald, but still then, just to, give me at least a kind of courage or like solace, I just told my son to shave it. But otherwise, most of the cancer patients who undergo chemotherapy, the hair falls. Not everyone, but especially for breast cancer and the experts know. So that kind of thought, that experience, it really jolted me. And I was not being myself. I didn't even want to pray sometimes. I was battling. And during my second chemotherapy, it was very difficult. The chemo side effect was so brutal. And I had diarrhea and then the nauseous feeling and everything. It really shook me. And at one point of time I thought I will not continue my treatment. But I had a very strong family support. So they encouraged me and that's how. After my third chemotherapy, I almost stopped praying at one point of time. In my dream, I saw my grandmother praying for me in the upper room. And she was praying in tongues. She was a very good Christian, and she has been dead for quite some years, some decades. But when I was sick, I saw my grandmother praying for me in the upper room. Then I told my siblings, I saw my grandmother praying for me in the upper room. So one of my brother who was in Lakh, he called me and told, aren't you praying? So I said, of course I am, but it's very difficult. It's very difficult. Then he flew to Calcutta and prayed for me. He prayed for me and then he left. During my fourth chemo, that was during my birthday, so my husband and all my children were there with me. They prayed over the chemo, the injections that I was going to take. It was a daycare for 2.5 hours in the daycare. So we prayed together, and when I went into the chemo room, I was just praying, silently praying. I closed my eyes and I was praying. Tears were trickling down my cheeks at some point, but I was praying. I didn't want, but I pushed myself and prayed. So during the chemo time, as I was praying, a warm feeling came over me. A very different warm feeling that was more like a warm blanket or something like that that wrapped around me. And then slowly my tongue began to twist. And I was quite surprised what's happening to me. But then again, I gave in. But the Holy Spirit is so intelligent. I would pray very quietly, and my tongues were twisting, and I was praying in tongues. But after the chemotherapy, my son, who cooked for me, said, Isa, I have cooked a very nice meal for you. Maybe after a few hours, you might have that chemo side effects, the nauseous feeling. So why don't you eat early? And then he pushed me to eat. I ate. And then I went to bed, and because I knew that I had chemo, that chemo side effect will automatically come. But when I was sleeping, I felt very strong. Nothing happened to my body. So in the evening at around 8, I called my sister-in-law. And then I told her, today something very amazing happened to me at the chemo room. and it's 8, but still my body is not, reacting to any chemo side effects. So she is an IAS officer, so very, very smart. She told me, Ini, God has done such a great thing in your life. Are you still waiting for something bad to happen to you? Oh my goodness, I realized, God has helped me, and then only I realized, oh my goodness, God has done a miracle in my life, and I'm not even realizing that. I told her, Aya, what a bugly. No, what a foolish woman I am. I'm not realizing what God has done in my life. And then from then on, all my, I took 6 cycles of chemotherapy. 3 was very brutal, but 3 without any major side effects, I could finish my my treatment. But during those days, I was very weak one day because some of my friends and few of them wanted to visit. So I said, boldly, I was not going to be weak, but that time, since different people were coming, I thought I'll wear a wig and wait for them. So, the kind of experience that I went through was, they wanted to pray for me. And there was one lady who doesn't even pray much. But that day she became so active in prayer. And then she was holding my hand and, praying and touching my hand if I'm wearing a wig. That kind of experience, just imagine how will you feel if you go through that kind of thing. And I got calls from many people. I think you should confess if you have done something wrong. Those were the words that was very bitter. Very bitter. Of course, I'm not perfect. I know I have many shortcomings, but that doesn't mean that I have killed somebody, I have done this, I have done that, I have brought this, I have done so many bad things, I see people do, but they are wealthy, they are healthy. But people were pushing me to, confess my sin. So after my treatment, I had 6 cycles of chemotherapy and 19 sessions of radiation. It was quite a long time. So after my treatment, I said, I'm going home, but I will not go home as a patient. I will not go home as a patient. I will travel a little bit and go home as a tourist. That I was trying to put myself into that. Oh, I forgot to share something. When I was going through the chemotherapy and the cancer treatment and the chemo and the radiations, every time, I listened to my body. And then anything unusual happens, I used to write it in a notepad. So when I go to the doctor's chamber, I can just freely share what I went through. Because when you go and visit a doctor, the white coat fear is there. Even when you are not feeling well, if the doctor asks you, how are you? We Nagas, we will definitely say, I'm good. Whereas I'm not good, I'm there for treatment. So every time something happened, unusual happened in my body, I listened to my body, I kept a note of all those things and took to the doctor's chamber. And during that struggle, when I was going through all those treatment and all those emotional turmoil, I used to write all the positive things that came into my mind. And also the negative things that came into my mind. And I will compare the positive and negatives. So when I started comparing, I just came to realize I'm such a bad person, I do not deserve the love of God, yet I was complaining. And that was one experience really I could introspect myself during my cancer treatment. And during my cancer treatment, the verse which the pastor read was an inspiration to me. And so, during that time, I read that, I wrote it on a chart paper and pasted on the bathroom door, the kitchen door, and anywhere I could see. And just opposite to my bed. So read it every time. And I kept encouraging myself and I said, I will not die but live, but I will declare the works of the Lord. And so I made a decision while in Calcutta undergoing treatment that once I go home, I will start visiting cancer patients. I will start praying for them. The God who helped me through the cancer treatment will definitely help those people in need. So once I came back from Kolkata, I started visiting cancer patients at referral hospital with their permission, of course, because that was the hospital that had the biggest amount or the list of cancer patients there. So that's how I started, and then gradually the team grew, and we had to, we met every month, and we used to pray and encourage one another. We invite doctors. I hope I'm not taking much of your time. We invite doctors from different departments, and that's how we used to encourage the patients undergoing cancer treatment. So that's how we came together and said, since we are a group now, let's give a name, and then that's how Beyond Cancer. Life beyond cancer. There is life, there is so many good things that we can do, even after cancer. So that's how our name is Beyond Cancer. That's how we christened that. And we kicked off officially in the year 2017. So far we have, of course we have registered as a society, but we have not seek any help from the government or anything like that. The members and the survivors, they are so giving. It's with their help that we are running the organization.
We all know that the very purpose of observing this World Cancer Day is to raise awareness, which we have already done through our DImapur session, about the cancer prevention, detection and treatment. And it also aims to encourage government and all individuals to come together to take action. And the very purpose of having this day is also to reduce the myths and the stigma that associated with the disease called cancer. And it also further aims to promote equitable access to cancer care worldwide. Today we are celebrating this World Cancer Day under the theme United by Unique. So what it really wants to say is, it means that it emphasizes on the cancer journey, because every cancer journey is unique. Because it is shaped by the person's biology, it is shaped by the background, it is shaped by the culture, it is also influenced by our finances, the beliefs, and the life experiences. So, despite all this, we come together and we are united in the common fight against cancer. The key idea behind this theme, United by Unique, it emphasizes on people-centric care. It encourages us that healthcare should adapt to individual, but not force individual to adapt to system. And it is also based on equity. It recognizes the disparities and access in to prevention, diagnosis, treatment, and support. This day, the celebration also implies that we should also listen to patients' stories, respecting their cultural and social differences. We should also come together for collective action, like where the government, health systems, communities, and families and individuals, we all should have a role to play in spreading awareness about this cancer disease. United by Unique calls for health systems that are flexible, compassionate, and fair to everyone. Everyone has different needs, perspectives, and challenges, whether it is medical, emotional, social, or cultural. and this must be honored and addressed in our care systems. The cancer awareness campaign encourages policy makers, healthcare providers, and communities to listen to everyone, and the caregiver experience and using them to shift our focus more with compassion, equitable, and effective cancer care for everyone. We have learned from our keynote address that even in Nagaland also we have so many cancer cases, different kind of cancers, and it is on the rise. And it's now we have to come together and we have to stand together so that we can fight this disease together. We have critical health access gap also because we have limited treatment facility in our state, and we are tend to hide our disease also. So lack diagnosis also another major challenges for every one of us. So while celebrating this World Cancer Day, we should keep in our mind that it is an important health day, and every one of us, we have to play our role in creating awareness about cancer prevention, early detection, and treatment. Many cancer can be cured if detected early and if detected early. This day is encouraging for every one of us, and when we come together, we used to learn from each other, we used to learn and share information. Well, after celebrating this or after observing this day, we should not just go like that, but whatever we have learned, we have to share our information. The knowledges that we have gained through this gathering should be spread to our near and dear ones, and we should encourage and we should stay strong in the fight. We should mark this day, and we should take that this day serve as a global reminder that cancer is not just a health issue, but a social, economic, and human rights issue as well. Let us use this important day to spread awareness, support this fighting for cancer, and encourage early detection and equal care for everyone. Let's stand united and stay strong, because only one person, one organization cannot do, but if we come together, we can make a difference. And I'm repeating it again and again, let's encourage each other and let's stand together. Thank you so much.
Today on World Cancer Day, we stand together as one community.
We pledge to raise awareness about cancer and its prevention.
We pledge to raise awareness about cancer and
Checkups.
we commit to healthy lifestyles, early detection, and regular health checkups.
To cancer.
We will speak up against stigma, fear, and misinformation related to cancer. We will work together to ensure access to care, support, and information for all.
Together we choose care.
Together we choose care.
Together we choose hope.
Together we choose hope.
Together we stand united by unique.
Together we stand on united by unique.
This is our pledge.
This is our pledge.
Thank you. Please be